Thank you very much, Nick and Corla. With statement. I was very interested to listen to the Taoiseach, and he set out the 6 criteria from the WHO, I think, in terms of how you manage the crisis, and I wanted maybe to go through each in turn in terms of our assessment of how we're doing. And first and foremost, in that critical issue of social isolation, again, I'd have to report, Taoiseach, that my sense as a country is that we have done well. We have actually shown that a Western democratic system without necessarily some of the strict controls that we saw in other countries, is able to actually self-regulate by and large. Police and guards have done a good job, but largely it's been people self-regulating. And my sense is, and the figures we're seeing from the CMO and others, is that self-regulation is working, is bringing the reproduction rate of the virus right down. And I think it's a great commendment to the Irish people that we've shown that capability. We shouldn't ignore that. Similarly, I was talking to a colleague this morning. You said the second test around PPE. Stephen Matthews, my colleague, was just telling me anecdotally this morning of a story of a local company. I think he knew a sail-making company that a business collapsed because there were no orders, obviously, with the downturn. But they've managed to turn it around and start producing gowns now at scale and using some materials they got that weren't being used in another industry, and being adaptive and being quick. And I think what the state did in terms of organising those 300 Aer Lingus flights, as much as there is still real tight pressure points, particularly in our nursing homes in terms of PPE, I think by and large an assessment would be, compared to other countries, that we've also done well in that regard. And thirdly, in terms of the positive side, I recall well at the start of this process talking directly to people involved in intensive care units in hospitals around the country, and the sense of terror they had, rightly, because when you saw what had happened in Italy and what had happened in Spain when a health system is overrun, that was really a daunting prospect. And while the workers in the front line there have had a really difficult time, I'm sure any assessment would be that actually we were quick and flexible in scaling up our ICU capacity and other hospital capacity, and that we have avoided that overrun of a system, which was the fundamental fear. And I think there's great credit to the HSE and to the people within our hospital system that flexibility. And even if some of it's now seen as overcapacity, you know, the contingency that we have, in my understanding, the numbers out in City West are minimal, tiny so far, thank God. And we've a lot of these private hospitals we've contracted, as Deputy Martin says, underutilising the beds now. But we didn't have to build emergency field hospitals. We did it in our flexible way, and I think we did it by and large well. So in those 3 of the 6 categories, I think you'd have to say that the state has actually reacted quickly and reacted well. On the other 3, firstly, with regard to how you protect vulnerable groups, and there was a prime time the other night, a professor from UCD making the point that our nursing home systems particularly wasn't able to adapt as quickly as we saw our hospital system did to the changed circumstances. And that there's a real tragedy there has unfolded, as has happened in other countries. We're not unique. And particularly not only for the patients but also the workers there who have a high instance, as I understand from our discussion with Dr. Tony Holohan yesterday, very high relative instance of infection. And I think if there's lessons to be learnt and changes need to be made here and now, it is in the need for us to look at our nursing home systems and how can they adapt possibly now and for any particular future waves of this pandemic. That's an area where no one could say, and it's not just our nursing homes, what's happening with some people in direct provision, or even in other, I know Deputy Martin's mentioned examples of certain particular sectors, be it meat factories or whatever, where we weren't able to make the changes that we were able to make in our hospital system. And that's something that we have to address now, but also learn lessons from the future. With regard to testing, the 5th of the 6 categories that you set out, Taoiseach, I again would say I think we started at least in making the correct strategic decision, unlike in the UK, maybe as one example, where we didn't abandon kind of community testing. We were willing to try and keep up testing even as the wave of the virus hit. I mean, it's clear that we haven't succeeded in actually delivering what we promised. And everyone has anecdotes on this. I mean, Mary Lou is personally, in our house, his son was tested 35 days, I think, ago, and we still haven't got the result. Now, he's as healthy as anything, thank God. But everyone has those stories, and that undermining of public confidence in those delays has been a real regret. And I think even though it's due to a variety of factors that may be out of control of certain of the health facilities, reagents and other issues, we should acknowledge that we weren't able to deliver what we promised, and we sure as hell have to start delivering what we promised now, because in the next phase of managing this crisis, what I remember Paul Reid saying, and the Assistant Director of the CMO saying, is that the testing really comes in as the critical issue when you start to open up the economy, so that you're really able to very quickly identify clusters, very quickly isolate those people and engage in contact tracing. So the account of how this state does in terms of how we manage this in the testing side, while we've got problems that have gone back now the last 6-7 weeks, the real test is in the next 6 months, 1 year. And this is a country which is leading in IT technology, which is leading in terms of a lot of medical health capabilities. We should be best in class, and we should make sure that our testing system is as fast as anywhere, and our contact tracing system is absolutely rock solid and quick. The sixth and last category, Taoiseach, you mentioned was economic welfare, and that's also the one that we really have to face and address now. And again, I'd have to commend the state, the government, in terms of the initial response was quick, which was part of what we need to do in providing the pandemic unemployment payments, providing immediate supports for business. But that really is only the first phase of what we need to do. And I think the unlocking of restrictions can't come quick enough, not just for the sense of people's public morale, but also because our economy is in a shocking state, and we need to start lifting it. In doing that, we have to do it commensurate with not allowing the virus to come back. So that's obviously a given. It's not one versus the other. But can we do both? There are certain key issues I think we should target what are our measures. Firstly, it's very clear that young people are the ones who maybe suffered disproportionately most. The statistics I saw last week or this week was that the level of use of the unemployment payment, the pandemic unemployment payment among young people, among those aged 18 to 24, was twice the level of any other age category. So they're the ones who are probably most out of work and we need to focus on. And secondly, with regard to small business particularly, again, if you look at the latest figures around where those, just to take that unemployment payment as an indicator of where it's hitting home, in the accommodation and food sector, which would be typically large numbers of small Irish businesses, the level of use of such payments because of the lockdown is 7 times the level of layoffs that occurred in the industrial and public administrative sector, 7 times higher. And our small business sector, and I come from it, so maybe I've got a particular interest in it. It's the heart of our economy. It's the strength of our community. It is a huge employer, but not just that. It's part of our culture. It's the high street. It's family businesses which mean a lot to people, and it's only when you're involved in one you know what it's like, that this is your everything, this is your whole, and often a history of family. And we're in real danger of losing so many of those small businesses if we don't really act quickly now to try and help them recover. Now, how we do that is a real challenge. You're facing a difficult choice this weekend in terms of this staged 4 or 5 stage rollout. I do hope we can start doing something this weekend, even if it's very small. Even I said to you yesterday, in terms of like a friend being buried this morning, a funeral, where the restrictions are you can only have 10 people, and this lovely woman was from a big family, and you can only be in the church or the funeral home, whatever, for 15 minutes. And I thought, we can do a funeral at social distancing, you know, and maybe not the big funerals of the past, but just slight easing of some of those restrictions. Our easing restrictions as well, and people being able to walk, we can trust our people to do this social distancing where our older people are able to get out and get exercise and get fresh air. But also I hope, and I mentioned it when I spoke here last week, a lot of those small businesses work in tourism, and I'm not reading the papers yesterday as much as I know what's planned, you know, to talk that we would be opening up late summer, to kind of possibly going to holiday in Ireland, if at all possible for us to get people, our young people particularly, the prospect of out walking, cycling, swimming, meeting, but not meeting carefully, and helping our small businesses recover. That too is part of the test we have as to how we manage this overall crisis.